Assalamu alaikum dear students. Today our topic is leggings. In this topic we will be studying the various cartilages, ligaments and membranes of the leggings. Then we will study the sensory and blood supply of the leggings. We will enumerate the intrinsic and extrinsic muscles of the leggings along with their actions and blood supply, and then we will discuss the Pigiform Fossa. Leggings is actually the upper expanded part of the lower respiratory tract, and it's modified for producing voice or phonation, so it is also called the voice box or organ of phonation. The primary function of the leggings is the protection of the lower respiratory tract. It prevents anything from entering the respiratory tract except air. Phonation has developed later on with evolution. Leggings is situated in the anterior midline of the upper part of the neck, and it extends from the root of the tongue to the trachea. It lies in front of the third, fourth, fifth and sixth cervical vertebrae. So in front of these four cervical vertebrae, the third, fourth, fifth and sixth cervical vertebrae. The larynx is composed of 9 cartilages, out of which 3 cartilages are unpaired and 3 are paired. Of the unpaired cartilages, this one is the thyroid cartilage. If we cut this lamina of the thyroid cartilage, we can see inside. So this is the thyroid cartilage. The unpaired cartilage is the thyroid cartilage. The next one is the cricoid cartilage. This one the cricoid cartilage. And the third unpaired cartilage is the epiglottis. So the thyroid cartilage, cricoid cartilage and the epiglottis are the unpaired cartilages. Of the paired cartilages, these two, the retinite cartilages and the claviculate cartilages and the cuneiform cartilages, they are small, while the paired cartilages are large. First we will discuss the thyroid cartilage. This is the thyroid cartilage. It is one of the largest laryngeal cartilage. It has 2 laminae which are joined anteriorly in the midline and posteriorly they are separate. Anteriorly joined in the midline and posteriorly they are separate. The most superior part of the fusion of 2 laminae project forward, and this is called the laryngeal prominence, and there is an angle between the 2 laminae which is called the thyroid angle. Superior to laryngeal prominence, here is a notch which is called the superior thyroid notch, and there is also an inferior thyroid notch. The posterior part, this part of the lamina, has prolonged upward to form the superior horn and downward to form the inferior horn of the thyroid cartilage. The medial surface of the inferior horn bears the facet for articulation with cricoid cartilage. The lateral surface of the thyroid lamina is marked by a ridge called the oblique line, which is the ends of which are expanded, which are called the superior thyroid tubercle and the inferior thyroid tubercles. So 2 tubercles. The oblique line is the site of attachment of extrinsic muscles of the larynx. Now we will discuss the epiglottis. Epiglottis is a leaf-like cartilage which is attached by its stem to the posterior aspect of the thyroid angle. The thyroid angle is the angle between the two laminae of the thyroid cartilage. This is the anterior aspect and this is the posterior aspect. And there is a ligament which attaches the epiglottis to the thyroid cartilage. This is the thyroepiglottic ligament. The posterior surface, this is the anterior surface of the epiglottis, this is the posterior surface. The inferior half of the posterior surface is slightly raised and this is called the epiglottic tubercle. Now we will discuss the lowermost cartilage of the larynx, that is the cricoid cartilage. The cricoid cartilage completely encircles the airway. It has a broad posterior lamina and a narrow anterior arch. The lamina on its posterior aspect bears two vertical depressions. This is the site for attachment of posterior cricoretinite muscle and a vertical ridge which gives attachment to the esophagus. It has two articular facets, one on the superior lateral surface which articulates with the base of the retinite cartilage. This is the retinite cartilage, this is its base. Another facet is on the lateral surface of the cricoid cartilage, the lamina of the cricoid cartilage, which articulates with the inferior horn of the thyroid cartilage. This inferior horn medial surface articulates with this facet. So this facet is for articulation with the inferior horn of the thyroid cartilage. Now we will discuss the retinite cartilages. There are two retinite cartilages which are pyramid shaped. They have three surfaces: the medial surface, the anterolateral surface, which is this one, and a posterior surface. They have an apex and a base. The base is concave and articulates with a facet on the lamina of the cricoid cartilage. The medial surface of the two retinite cartilages face each other, and the anterolateral surface bears two depressions separated by a ridge. The upper depression is for the attachment of the vestibular ligament and the lower depression is for the attachment of vocalis muscle. The posterior surface gives attachment to the retinites. The anterior angle of the base is prolonged forward to form the vocal process, which gives attachment to the vocal ligament, and the lateral angle is prolonged to form the muscular process, and the muscular process gives attachment to the posterior cricoretinite and the lateral cricoretinite muscles. The apex has a facet through which it articulates with a very small cartilage called the cuneiform, called the corniculate cartilages. So this apex has a facet for articulation with corniculate cartilages. Then the two small cartilages, corniculate cartilages, which articulate with the retinite cartilages, and the two small club-shaped cuneiform cartilages which are suspended in the fibroelastic membrane between the epiglottis and the retinite cartilages. So they are suspended in the fibroelastic membrane between the margin of the epiglottis and the retinite cartilages. Now we will talk about the extrinsic ligament of the larynx. This one is the thyroid membrane, this is the hyoepiglottic ligament, and this is the cricotracheal ligament. These are the extrinsic ligament of the larynx. The thyroid membrane is attached inferiorly to the upper margin of the thyroid cartilage, and superiorly it is attached to the hyoid bone. There is an opening in the thyroid membrane which is for the internal branch of the superior laryngeal nerve and the superior laryngeal artery. Laterally, this thyroid membrane is thickened to form the lateral thyroid ligament, and anteriorly in the midline it is thickened to form the median thyroid ligament. The other one is the higher epiglottic ligament, which is between the hyoid bone and the epiglottis, and the third one is the cricotracheal ligament, which is between the cricoid cartilage and the first tracheal ring. Now we will study the fibroelastic membrane of the larynx. We are studying the intrinsic membrane and ligaments of the larynx, and in this is the we are studying the fibroelastic membrane. The fibroelastic membrane of one side and another side actually form a tube which is present inside this laryngeal cartilages, which also form a tube. So on outer side are the laryngeal cartilages, and on the inner side is the fibroelastic membrane of one side and other side. They also form a tunnel or tube, and to the inside is lined by the mucous membrane of the larynx. So this is the thyroid cartilage, anterior part of the larynx, thyroid cartilage. If we cut the thyroid cartilage, then the fibroelastic membrane become visible. This is the side of the larynx from which we have cut the one of the lamina of the thyroid cartilage, the other being intact. We have cut this lamina so that the inside of the larynx become visible. The inside of the larynx is nothing but fibroelastic membrane on this side and fibroelastic membrane on that side, and there is a passage between these two. So if we look at the fibroelastic membrane, it is interrupted in between. So it is made up of two parts, the lower part and the upper part. The lower part, this one, is called the cricothyroid ligament or cricothyroid membrane, or they call it as cricovocal ligament, because this is the its thickened part is called the vocal ligament. So it is between the cricoid and the vocal ligament, so it is called the cricovocal membrane, or its other name is conus elasticus. Conus elasticus. This cricothyroid ligament is attached to the arch of the cricoid cartilage. This is the arch of the cricoid cartilage, and this is the on the back is the lamina of the cricoid cartilage, on which are sitting two retinite cartilages. So in front is the thyroid cartilage, on back are the two retinite cartilages sitting on the lamina of the cricoid cartilage, and on the side is the arch of the, and front is the arch of the cricoid cartilage. On the back, one retinite cartilage connecting one fibroelastic membrane and the other one connecting another fibroelastic membrane, and the various muscles moving them so that these can also move. So this cricothyroid ligament, or what we call the conus elasticus, is attached to the arch. Below it is attached to the arch of the cricoid cartilage, and when we trace it upward, its upper margin is free because it is not connected to this part, which is called the quadrangular membrane. It is not connected to the quadrangular membrane, but it is free. So the upper margin of this conus elasticus is free, but anteriorly it is connected to the thyroid cartilage, and posteriorly it is connected to the vocal process of the retinite cartilage. The vocal process is a structure which is situated medially. So this part between the thyroid cartilage and the vocal process of the retinite cartilage become thickened, and it is called the vocal ligament. It is called the vocal ligament, which forms the then the two vocal cord with mucous membrane. It forms the two vocal cord or vocal fold. So it forms the two vocal cord. That is about the conus elasticus or cricothyroid ligament. This bridges the lower side of the cavity, laryngeal inlet and then laryngeal cavity. After this we will be studying this part which is called the quadrangular membrane. We will be studying the quadrangular membrane. But before we say that, this anterior part of the cricothyroid ligament is thickened, and it is called median cricothyroid ligament. It is called the median cricothyroid ligament. We are studying the fibroelastic membrane. We have studied its lower part, the conus elasticus. Now we are studying its upper part, which is called the quadrangular membrane. This quadrangular membrane above is attached to the lateral margin of the epiglottis, not the anterior, attached to the lateral margin of the epiglottis, and anteriorly to the thyroid cartilage, and posteriorly it is attached to the anterolateral surface of the retinite cartilage. We said that on anterolateral surface of the retinite cartilage there are two depressions separated by a ridge. It is attached to the upper depression, and there is a cartilage sitting on the top of the retinite cartilage which is called the carniculate cartilage. So it's also attached to the carniculate cartilage. And this, if we look at this, this is the one free margin, this is the other free margin of the quadrangular membrane. So the quadrangular membrane has two free margin, the upper free margin and the lower free margin. The upper free margins is between the epiglottis and the retinite cartilage and the carniculate cartilage. This forms a fold which is called epiglottic fold. The lower margin between the angle of the thyroid, the lower margin is free, and it is anteriorly attached to the angle of the thyroid cartilage just above the attachment of the vocal ligament. This thickened part, the lower free margin, which thickens and forms the vestibular ligament, it is anteriorly attached to the angle of the thyroid cartilage just above the attachment of the vocal ligament, and posteriorly it is attached to the anterolateral surface of the cricoid cartilage. And this vestibular ligament under the fold form the false vocal cord. So this forms the false vocal cord, and this is the true vocal cord. So one thing we must keep in mind, that the true vocal cord is attached medially, because the vocal process to which it is attached is situated medially. So this is medially, and the false vocal cord, this is attached, the vestibular ligament attaches to the anterolateral surface of the retinite cartilage. So this is anterolateral surface is lateral as compared to the vocal process of the retinite cartilage. So this fold will be lateral and this fold will be medial if we look it from above here. So this one is the vocal ligament, and lateral to this is the vestibular ligament. So this one will be lateral, the vestibular ligament, and the vocal ligament will be medial to it, and there is a gap between these two. Now that we have studied the fibroelastic membrane, let us see what this fibroelastic membrane along with the cartilages has done. It forms a cavity inside which is called the laryngeal cavity. The laryngeal cavity extends from the inlet of the larynx. This is the inlet of the larynx. It extends from the inlet of the larynx to the lower border of the cricoid cartilage, where it is continuous with the trachea. This laryngeal inlet is made up of the epiglottis, the ariepiglottic fold, the fold between the epiglottis and the retinite cartilage. This is the area where the retinite cartilages are present, and this is the lamina of the cricoid cartilage, which is, we are seeing it from posterior aspect. So the laryngeal inlet is facing posteriorly. This is made up of the ariepiglottic fold, the margins of the epiglottis, and there is a fold between the two retinite cartilages, which is called the mucous fold, which is called the interaretinite fold. So this interaretinite fold and this ariepiglottic fold, also fold of mucous membrane. So these two folds, the ariepiglottic fold on either side, the interaretinite fold, and the epiglottis makes the inlet of the larynx, and the outlet, this one which leads to the trachea, is found by the lower border of the cricoid cartilage. We know that the cricoid cartilage is forming a complete ring. It is forming a complete ring. So this is the complete ring formed by the cricoid cartilage and retinite cartilage sitting over them, and the fibroelastic membrane going that way and attaching to the thyroid cartilage, and another fibroelastic membrane on this side. So this is the laryngeal cavity. So if we cut this and see how it looks like, then we can also see the false and true vocal cords. Now that we have studied the formation of laryngeal cavity, which is formed by this fibroelastic membrane of both sides and the cricoid cartilage, these are forming the laryngeal cavity. If we cut open this laryngeal cavity and look at it, it will look like this. The laryngeal cavity is divided into three parts by the vestibular fold and the vocal fold. The part below the vestibular fold is called the vestibule or the supraglottic compartment, and the part below the vocal fold is called infraglottic compartment. The part between these folds, this part in which this mucous membrane is projecting like this way, the space between these two folds is called the glottic compartment. So the supraglottic compartment, infraglottic compartment, and the glottic compartment. This glottic compartment is also called laryngeal ventricle. This is called the laryngeal ventricle or the sinus of the larynx. So its names are laryngeal ventricle, sinus of the larynx, or the glottic compartment. So supraglottic, glottic, infraglottic. The supraglottic is also called the vestibule. So this is how the cavity from inside look like. It is covered by mucous membrane, and this is the folding of the mucous membrane, forming the folds, the vestibular fold and the vocal folds. If we look, this is the supraglottic compartment, this is the glottic compartment, and this is the infraglottic compartment. Now we will study the Pigiform Fossa. The Pigiform Fossa is a recess between the ariepiglottic fold medially and the thyroid cartilage and thyroid membrane laterally. Deep to the mucous membrane of this fossa lies the internal laryngeal nerve and the recurrent laryngeal nerve. It is the internal laryngeal nerve that can be damaged here, and then followed by the loss of sensation in the supraglottic compartment or vestibule of the larynx. The clinical significance of the Pigiform Fossa is that it is the common place where the foreign bodies are lodged, and if it's injured, it gives a sensation that something is stuck in the throat. Now we will discuss the muscles of the larynx. There are two types: extrinsic muscles of the larynx, which are attached to the larynx and it attaches the larynx to the surrounding structure and is responsible for the movement of the larynx as a whole. Whenever it moves, they move the larynx as a whole, and they are paired muscles. The intrinsic muscle of the larynx, they move the larynx in part. They include the cricothyroid, this one, between the cricoid cartilage and the thyroid cartilage. The name is which bones they attach. So cricothyroid, it means attached to the cricoid and thyroid cartilages. Then the cricoarytenoids, these are muscles which join the cricoid to the retinite cartilages. The cricoid to the retinite cartilages. These are two. One in on the lateral aspect which join the cricoid to the retinite. This is called lateral cricoarytenoid, and another is on the posterior aspect which join the cricoid to the retinite, and this is called posterior cricoarytenoid on either side. Then comes to the retinites, which are between the retinite cartilages. So in between the retinite cartilages, one muscle is in the transverse direction from one retinite cartilage to the another retinite cartilage, that is called the transverse retinide, and the other one is oblique, going obliquely. This is called the oblique retinide, and the oblique retinide has a continuation upward. A part of it goes upward through the epiglottis. This is called epiglotticus. So oblique retinide, epiglotticus. Then the thyroarytenoid, which attaches the thyroid cartilage to the retinite cartilage, the thyroarytenoid. So the thyroarytenoid has some fibers which go from the thyroid cartilage to the epiglottis. They are called the thyroepiglotticus. And a part of which of this thyroarytenoid muscle, which is present medially and cannot be seen here, and which is now detached from this muscle. Now it is not considered a part, but it is the detached part of the thyroarytenoid muscle, and that is this muscle. If we remove this part, we will see this muscle. This is called vocalis. So vocalis is the detached part of the detached medial part, because this is on the lateral side. So if we remove it, on the medial side will be its detached part, the vocalis muscle. So these are the muscles of the intrinsic muscles of the larynx. Now we will study their origin, insertion, actions, and nerve supply. Now we will discuss the origin and insertion of the intrinsic muscle of the larynx. These muscles are attached between the various cartilages. So this is the retinite cartilage, this is its apex, this is its base, this is the vocal process, this is the muscular process, this is the anterolateral surface of the retinite cartilage, which has two depression and a ridge, and this is the cricoid cartilage, the arch, and the lamina. Let us first discuss the cricoarytenoids. We have said that cricoarytenoids are two. One is the posterior cricoarytenoid, another is the lateral cricoarytenoid. The posterior cricoarytenoid arises here from the depressions at the back of the lamina of the cricoid cartilage from the back, and is attached on the posterior aspect of the muscular process of the retinite cartilage, coming from the back anteriorly, and is inserted on the back of the muscular process of the retinite cartilage. Then is the lateral cricoarytenoid muscle. The lateral cricoarytenoid muscle arises here from the lateral part of the upper border of the arch of the cricoid cartilage, and it is inserted into the lateral aspect of the muscular process of the retinite cartilage. So the posterior one coming from posterior side and attaching posteriorly to the muscular process of the retinite cartilage, and other coming from this part and attaching laterally to the muscular process of the retinite cartilage. So these are the anterior and these are the posterior and lateral cricoretinites. Then coming to the muscles between the retinite cartilages, that is the retinites. So these are one muscle which is transversely attached on the posterior aspect of the posterior surface of the two retinite cartilages, that is the transverse retinite, and one retinite muscle arises from the muscular process of one retinite and goes obliquely upward and is attached to the apex of the other retinite cartilage, and same is the other. So this is the oblique retinite. Other is the epiglottis that arises from the muscular process and is inserted into the margins of the epiglottis. So that is epiglotticus. Coming to the thyroid. So the thyroid muscle arises from the thyroid muscle arises not from the cricoid cartilage but arises from the thyroid cartilage. It is between the thyroid and retinite cartilages. So it arises from the thyroid cartilage near its angle on its posterior aspect and is inserted into the anterolateral aspect of the retinite cartilage. So this is thyroretinite, and a part of it which arises from the angle of the thyroid cartilage and inserted into the epiglottis is thyroepiglotticus. So these are the origin and insertion of the muscles of the intrinsic muscles of the larynx. Now we will discuss the actions of intrinsic muscles of the larynx. So before discussing the intrinsic muscle of the larynx, let us describe what is adduction and abduction of the vocal cord. This is the vocal process to which the vocal cord is attached and which is anteriorly attached to the posterior aspect of the near the angle of the thyroid cartilage. So when this vocal process moves medially, what will happen? That the vocal cord will also move medially with it, and this is called adduction. When the vocal cord moves towards the midline, it is called adduction. And if the vocal process move laterally, the vocal cord will also move along with it laterally, and there will be abduction of the vocal cord. Let us see which muscle are causing adduction of the vocal cord, bringing the vocal process of the retinite cartilage medially will lead to adduction of the vocal cord. We have already studied that the cricothyroid is causing adduction. Before this we studied the cricothyroid. We said that the cricothyroid is causing adduction. So one of the adductor is the cricothyroid. Let us see other adductors. This is the lateral cricoretinite muscle and is attached to the vocal process and to the cricoid cartilage laterally. So its direction of pull is forward and laterally. It is pulling the muscular process of the retinite cartilage forward and laterally. What will happen when this moves forward and laterally? The vocal process will move medially, and along with it the vocal cord will move medially, and there will be adduction of the vocal cord. Another muscle which is causing adduction of the vocal cord is the transverse retinite. The transverse retinite is attached to the posterior surface of the retinite cartilages, not to the muscular process. It is attached to the posterior surface. So when it contracts, it brings the two retinite cartilages medially, and along with it the vocal cord also moves medially, and there is adduction of the vocal cords. Another muscle which is thyroarytenoid, its direction of pull is also forward and laterally. It is directed forward and laterally, so it also causes adduction of the vocal cord because it is pulling the retinite cartilage forward and laterally, and this will move the vocal process medially and along with it the vocal cord medially, and this will cause adduction of the vocal cord. This will also pull the retinite cartilage forward and will relax the vocal cord. Another muscle, this one the vocalis muscle, its direction of pull is forward only, so it is pulling the retinite cartilage forward only, so it will relax the vocal cord. So these are the actions of different muscles which are causing adduction of the vocal cord. Up till now we have discussed the adduction of the vocal cord, which is caused by the lateral cricoarytenoid muscle, the transverse arytenoid muscle, the thyroarytenoid muscle, and the cricothyroid muscle. Let us see which muscle is doing abduction of the vocal cord. So if we look at this muscle, the posterior cricoarytenoid muscle, this is attached to the posterior aspect of the muscular process of the retinite cartilage, and here it is attached to the lamina of the cricoid cartilage on its posterior aspect on the depressions which are located there. So its direction of pull is backward and medially, so it's pulling the muscular process backward and medially. So what will happen, that the vocal process will move laterally, and along with it the vocal cord will also move laterally, and this will cause abduction of the vocal cord. So the only intrinsic muscle of the larynx which is causing adduction of the vocal cord is the posterior cricoarytenoid. This is very important muscle. This is causing adduction. So it is the abduction. This is the only muscle which causes abduction of the vocal cord. Now we will discuss the muscles which close the laryngeal inlet and those which open the laryngeal inlet. So the oblique retinide and the epiglottis from both sides, when they contract, they close the laryngeal inlet because their direction of pull is downward and medially, so they close the laryngeal inlet. The thyroepiglottis, this one thyroepiglottis, pull the laryngeal inlet towards the thyroid cartilage laterally, and the lateral pull opens the laryngeal inlet. So the thyroepiglottis is opening the laryngeal inlet, while the oblique retinide and epiglottis is closing the laryngeal inlet. We have said that the posterior cricoarytenoid is the only abductor of the larynx. So if it is paralyzed, there will be unopposed action of the adductors, and this will lead to death of a person due to lack of air. All intrinsic muscles of the larynx are supplied by the recurrent laryngeal nerve. All the intrinsic muscles of the larynx are supplied by the recurrent laryngeal nerve, except the cricothyroid, which is supplied by the external laryngeal nerve because it is present on the external surface of the larynx. Now we will discuss the cricothyroid muscle. It is the only muscle of the larynx which lies on the external surface of the larynx. It is a small fan-shaped muscle which arises from the anterolateral aspect of the cricoid cartilage. After its origin, its fibers pass backward and upwards to be inserted into the inferior carno and adjacent lower border of the lamina of the thyroid cartilage. It is supplied by the external laryngeal nerve. When it contracts, what happens? Before its contraction, let us look at the vocal cords. This is the retinite cartilage, and this is the vocal process of the retinite cartilage, to which is attached the vocal cord, and the vocal cord is here attached to the posterior aspect of the angle of the thyroid cartilage. So it is attached to the thyroid cartilage at the angle of the thyroid cartilage. This is the vocal cord. This is its original position. So when this muscle contracts, what happens? That its origin is this one and insertion is this. So it pulls the thyroid cartilage forward. It pulls the thyroid cartilage a little forward and downward. So it changes its position like this. So the thyroid cartilage has come a little downward and forward. So what happens to the vocal cartilage, vocal ligament? That it lengthens. So it causes the vocal cord to become tense. So it causes lengthening and tensing of the vocal cord. It's also help in the adduction of the vocal cord. Now we will study the arterial supply of the larynx. The larynx above the vocal cord is supplied by the superior laryngeal artery, which is a branch of the superior thyroid artery, while below the vocal cord it is supplied by the inferior laryngeal artery, which is a branch of the inferior thyroid artery, which in turn is a branch of the subclavian artery. Now we will discuss the venous drainage of the larynx. The larynx is drained by the superior laryngeal vein, which in turn drains to the superior thyroid vein, and it is also drained by the inferior laryngeal vein, which in turn drains into the inferior thyroid vein. Now we will study the nerve supply of the larynx. The motor supply of the larynx is provided by the internal laryngeal nerve and the external laryngeal nerve, while the sensory supply of the larynx is the mucous membrane of the larynx above the vocal folds is supplied by the internal laryngeal nerve. The mucous membrane of the larynx above the vocal fold is supplied by the internal laryngeal nerve, while below the vocal fold it is supplied by the recurrent laryngeal nerve. And if the internal laryngeal nerve is damaged, what happens? There is anesthesia of the mucous membrane in the supraglottic portion and loss of protective cuff reflex. Since that area is supplied by above the vocal cord, the vestibule is supplied by the internal laryngeal nerve. So if the internal laryngeal nerve is damaged, there is anesthesia of the mucous membrane in the supraglottic portion or vestibule of the larynx, and there is loss of protective cuff reflex. As a result, foreign bodies easily enter the larynx.